A 65-year-old African American man is admitted to the hospital for the severe shortness of breath. He states that he has been having increased difficulty breathing when performing physical activity. Lung auscultation reveals bilateral crackles. His blood pressure is 125/85 mmHg and his heart rate is 85 per minute. Cardiac auscultations detects no rub, no murmurs. Blood examination are not suggestive of infection. Coronary artery angiography is performed and no significant vascular disease, which is the most likely cause of this patient's disease manifestation. So I can say that the blood pressure is not so high, it's normal high, okay. The heart rate is not so high and there is no rub, there is no murmuring, there is no sign of infection, okay, and there is no coronary artery disease, okay. It's significant, there is no disorder. So what should be the cause? But we have a one point, that is the auscultation of the lung reveals bilateral crackles. So there are two conditions in which we can hear crackles. Number first, it may be pneumonia. Number second, it may be fluid into the lung. But here they deny any sort of infection, so it may be pulmonary edema. So the patients present with the shortness of breath and dyspnea on exertion. The bilateral crackles detect on physical examination indicates a pulmonary edema. The spectrum of the sign and symptoms are suggestive of the left ventricular dysfunction leading to the congestive heart failure. So congestive heart failure itself has many causes, but the lack of other clinical finding, for example in this patient we cannot see any sort of rub, okay, there is no murmuring, indicate either it may be the hypertensive heart diseases or some sort of cardiomyopathies as likely etiologies. So cardiomyopathy can divide it into dilated cardiomyopathy and hypertrophic cardiomyopathy or restrictive cardiomyopathy. In all these conditions there will be less cardiac output. So when there will be less cardiac output, the demand is the body need is increased, so there will be the positive feedback mechanism, or we can say that there is a reflex tachycardia. So the heart start to pump more rapidly, as we see that the heart rate little bit increase, that is 85 per minute. So alcoholism and Coxsackie viruses, some parasites and some medications, they are associated with the abnormalities of the cardiomyopathies. So we can see here that aortic stricture, no, this is not an answer. If this should be there in this patient, so then at that time we can hear some sort of murmuring in this condition, okay. And fibrosis of, no, if fibrosis of the endocardium, then we can find some thing into the myocardium. And fibrotic deblets within, there is no fibrotic deblets. If some fibrotic deblets, we can see that we can listen some rubbing, okay, of during the heartbeat. So this is not ischemia. No, if there is ischemia, then there should be some coronary artery angiography shows some sign of atherosclerosis or some ECG changes, okay. So our choice should be the ventricular dysfunction. Thank you.